So what we're doing here is neck liposuction, or a submental lipoplasty. Basically, we're removing fat from underneath the chin, neck area. So this is the area that we're concerned with, and you can see we have a little pinch of fat here. You can take care of this fat several ways, Kybella, but Kybella really hurts, and you can't just do one treatment, you actually have to do 3 treatments or more. Or you can do, as we're doing here today, liposuction. So I'm going to make one incision, tiny incision behind the chin there, getting rid of the fat right in there, and then she also wants more of a defined jawline in here. To achieve that, I'm going to also approach it from the front here and also from behind the ear here to get her more definition to that jawline. So let's go to the operating room and I'll show you how we do submental lipoplasty or liposuction of the neck. So we're doing neck liposuction here. I'm doing a 3 approach technique, one underneath the chin and then one underneath each earlobe. I essentially put in 100 cc's of Tumescent solution here. So we're going to sculpt out underneath the chin area, the submental region, and the jawline here around the mandible to get her as much contour, mandibular definition, jawline definition as we can.
Just like they could save us. When these walls we feel so high.
Under general, it takes me maybe maximum like an hour. Even the larger necks, we do a lot of neck liposuction on patients that really do not want a neck lift, just want neck liposuction. So what we'll do is a lot of aggressive liposuction.
Forgive and forget. I'm standing with this white flag.
In this area, you want to be pretty careful. Variety of reasons. There's some pretty big blood vessels in here. We don't want to get into those. So basically, I'm just underneath the skin at the angle of the mandible here. The cannula, which is this metal straw in my right hand, is a special type of cannula. It's spatulated. That means it looks like a spatula at the tip. So there's nothing sharp. So that means no nerves can get transected or cut. Right now, I'm using the suction port on the upside. That means it's just sucking fat underneath the skin. And then in a minute, I'm going to go down on the downside to suck fat that's a little bit deeper. On average, bruising and swelling sort of stays in place for about 10 days, 2 weeks, really depends on the patient. If you bruise easily, well, the bruising will stay there for longer. Some patients, when I do this procedure, don't have any bruising. She has a little roll at the bottom, just cleaning that up, getting rid of that strip of fat in this lower. You can see the skin crease here, and there's a roll of fat here. And I'm trying to just attack that and get that out.
So high, why we keep falling for ages, always trying to reach for something, but all we ever find is nothing. Over and over and over again, isn't it time we forgive and forget?
So we're done with the neck lipo. Again, we concentrated on a couple areas here centrally. This little triangle from the chin down to the clavicle, medial clavicle. And then here laterally over the neck, I approach that from the bottom of the ear as well as the bottom of the chin to sort of get this, we call it a chin strap area. So we have a nice definition now of the submental, or the underneath the neck region right in there. And she wanted some more definition of the mandibular line, basically the jaw bone to the neck. So we define that really well for her. Thanks for watching. Please subscribe. We'll see you next time.